All right, welcome to Learning from Caregivers, an interview series where we'll be digging into the latest information for both on-the-ground caregivers as well as caregiving scientists to help people support the needs of older adults, their families, and communities. This is a podcast for health professionals and for all of us who care for older adults. My name is Joan Monin, and I'm a professor at Yale School of Public Health. And today we're going to be talking about music therapy and dementia. And I'm so happy to have with me today Shannon Kiley, Daniel Palese, and Dr. Jody Sharninghausen. And Shannon is a board-certified music therapist at LiveWell in Plantsville, Connecticut. And Daniel is also a board-certified music therapist, and he works at the West Haven, Connecticut VA. And Jody is a doctor in internal medicine at Yale with an affiliation at West Haven VA and is working to get music into more healthcare settings. So welcome, Shannon, Daniel, and Jody. Thanks for sharing the latest science on music therapy and dementia, as well as your clinical perspective. I'm going to start off with a fun question, which is, what is your favorite instrument and why? We'll start with you, Jody.
Okay, thank you so much. My favorite instrument is the piano because of the versatility.
That's a great answer.
Yeah.
Seconding, thank you so much for having us on this this podcast. And my favorite instrument has to be the cello. It's my whole soul. But also, my secondary answer is my favorite instrument is the one that's in front of me. And I get to play.
Amazing. I think that's like a great, that's like the music therapist sort of like perspective too right there. Hello, my name is Daniel. Also, thank you so much for having me and everyone here on this podcast. My favorite instrument is probably the one that's right behind me. It's a guitar. It is, I feel like when most folks think of me at my job site, they associate I'm carrying some amount of instruments, but I always have a guitar on my back. It's portable. I still love singing with it. There's a tactile experience to it too, where I just love like just bending the strings under my fingers. And there's also the 13-year-old that always wants to be like on stage under lights and all that fun stuff.
Yeah, I grew up with a dad who played guitar, so I have like a special connection to listening to guitar. I feel like I tried to play it, but my fingers like weren't strong enough and I didn't have the patience. But maybe one day I'll learn how to play guitar.
You can start with ukulele.
Yeah.
It's a little more accessible, fewer strings, and the strings are nylon, so they don't hurt as much when you're starting.
Yeah, I know that's really common. Okay, I'm going to start with ukulele first. So I wanted, this is the first serious question, but what are the different ways that music is currently present in hospitals, rehab, and long-term care settings? And what's the difference between music therapy and therapeutic music for people living with dementia and their families? And Jody, we'll start off with you with that question.
Great. Yeah, thank you. So I'll just start with definitions. So music therapy is the clinical and evidence-based use of music interventions to accomplish individualized goals within a therapeutic relationship by a credentialed professional. And it can address a variety of healthcare goals: physical, cognitive, psychological, social. And it's an allied health profession with rigorous training requirements similar to physical or occupational therapy. And the patient is often actively involved in the music-making process. And then therapeutic music, on the other hand, also sometimes called music medicine, encompasses many other ways that music can be used for healing. It's often more about the music itself and the enjoyment that it can foster. And it can be administered by anyone from like a musician to a lay person.
First of all, I just want to thank you for, it's not often that when folks are asked to define what music therapy is, that we get the correct definition from someone who's not a music therapist. So I appreciate that so much, because I've repeated that AMTA definition so many times to so many people.
Yeah.
But I also love just a quick summary of the AMTA definition is the use of music for a non-musical goal, essentially, is what music therapy is. But of course, the certification of the practitioner is of vital importance in the same way that I can brush my friend's teeth, but that doesn't make me a dentist.
Yeah, good analogy.
Yeah, I think people are always kind of wondering about what's the difference between music therapy versus things like music and memory approaches, right? Like people can utilize music, but they're not a music therapist, and kind of differentiating what is the value of like having a music therapist specifically.
Yeah. I think even going off of what both of you said about music therapy and having those the MTA definition, as well as noting how the non-musical goals are essential in that experience, but also even noting that speaks to the versatility of music in general, where we don't own music. Everyone should have access to music, sure, but also in music therapy, we have these non-musical goals. We also have that relationship that also occurs in that space. So facilitating moments of relationships between either ourselves, the clients we work with, or the clients and other folks in the room. Either it could be their caregiver or other patients, in my case, other veterans. Mm-hmm. But for me, the relationship aspect has always been very essential.
Yeah.
Yeah.
I love the highlighting of community and communication. And Jody, as you're thinking about the different programs that are in like hospitals and rehabs and long-term care facilities, can you say like a little bit more about the variety of experiences that both relate to kind of communication and a sense of community versus maybe other goals that are maybe kind of more like centered on just one person or something?
Yeah, absolutely. I mean, so I can talk about something that I've been involved in locally at Yale St. Raphael campus. So I've worked with Judy Lee, a medical student, and Dr. Richard Maritoli, a geriatrician, as well as hospital volunteer department, to do a therapeutic music program, sort of loosely based off of music and memory. And over the past a couple years, we've had 8 student volunteers who would take music history. So I think that speaks to sort of the individual like relationship aspect. They would ask about, songs from weddings and from meaningful events in the person's life. And if the patient had dementia and wasn't able to provide that, they would try to call a family member. And then they would build playlists for the patients to listen to during the hospital stay. And then our volunteers, Kayla and Manasa, did lead a qualitative analysis. They did some pre and post interviews of the patients. And some of the core themes that came out of those interviews were feeling calmer and more relaxed, more positive, reminiscent, a want to sing and dance, and physically and emotionally healed after listening to the music. So, I think this, and then the program actually over time has evolved to become more nursing driven. And we're really excited that the nurses are reporting using the music to sort of help calm really difficult behaviors or agitation, kind of going to that before or instead of more invasive interventions like sedating medications or physical restraints.
I imagine it's really helpful for the nurses themselves too, right? Because we all respond to music usually in a calm way, or giving someone a medication is going to be a lot different than soothing someone with music that you both enjoy. So, do you know if there's any research on that aspect of like the actual nurse being affected by the experience?
That's a good question. I think some studies have showed that there's a higher degree of like satisfaction or like feeling that you're doing a good job caring for patients that otherwise can be very difficult to care for. So people with advanced dementia. So yeah, I think I think there's room for like more research on that. But it can help with burnout and potentially like retention because there is such a high rate of sort of burnout and distress among people caring for, people with delirium and dementia.
Mm-hmm. Yeah. That kind of leads to my next question, and I'll have Shannon maybe ask this or answer this, but when we talk about music, helping with functional abilities and communication for people living with dementia, what are some of your experiences using certain techniques that you find helpful for communicating and all kinds of different ways to, amplify functionality for people who have cognitive change?
Yeah, that's a great question. Thank you. I want to touch real quick on the caregiver side of it before jumping into that. Just to say that one of the study proposals that Yale has in right now is also going to hopefully be gathering data on the effect of the music session on the care partner, as well as the person living with dementia. And in one of the previous studies, I believe that same group had done, the effect was greater on the caregivers than it was on the person living with dementia themselves. And that's not to be underestimated. Caregiver burnout is such a huge issue. Especially, at a time of such a huge shortage in healthcare workers in general and our aging populations. But yeah, circling back to functional support, one of the benefits of music is that there's so many different ways that you can apply it because it has so many different aspects that are useful. We all sort of tacitly agree that music is powerful and that, there's all kinds of platitudes about music, where words fail, music speaks, and all those things are true. And I think also we get so used to hearing it that the meaning of that is almost lost. Mm-hmm. But because then, we get into spaces where there's this tug of war a little bit between our implicit knowledge of how much we know music is powerful and effective, and then also the need to scientifically prove different aspects of how it's effective. And we can do that, certainly, but music is so multifaceted that usually you're just looking at a couple different aspects of what the music is doing in any particular study. But we know that music engagement is a whole mind, body, spirit exercise and experience. And so if you have somebody who is engaged in a music experience, the music therapist, if they are working with a music therapist, the music therapist is tailoring the music experience to target the area that the person is working on the most. So let's say, for instance, that the music therapist is working with somebody with a stroke. They might introduce a melody with a functional song or a functional phrase that they need, and then over time fade the music out so the person is left just with the phrase. But music engages almost every part of the brain when we're actively involved with it. The areas in the back that govern heartbeat and breathing are also processing the rhythm, and then the processing of the actual sound and the meaning of the lyrics and our emotional connection to it. And there's so much crosstalk between different sections of the brain. So just in general, as a general cognitive support, I think there are very few things that we have readily available to us that are as powerful as music. But so specifically about communication, I'll try to wrap up this answer and pass it on. But for communication difficulties in particular, we'll be using a lot of the lyrical aspects of music to help preserve speech abilities. And also, if we're able to work with somebody in a more tailored way, that can be more precise. So I hope that answered your question.
Yeah, definitely. And bringing up just the, the memory of being able to speak by singing and then kind of fading the music away is such a cool way to think about how to use music. And then I was also thinking about the stimulation of the vagus nerve and calming someone, right? Because we hear a lot about, when you're anxious, you tend to kind of go up and go inside your head, but really what you should be doing is kind of going down and using kind of your voice to sing, because that actually would calm you better than ruminating up above, right?
It offers you an embodied experience, which is often what I think of in terms of specifically working in the group that we ran, as well as the other dementia and caregiver group that I run at the VA. the closer I can get or the quicker we can get to an embodied experience, I think that can integrate a lot of aspects of what you noted, how music is this incredibly versatile, all-encompassing way for someone to engage with themselves and the world and with others. So just the nature of singing, you're taking these big breaths, you're exhaling, you're hearing your own voice being used, people are hearing you. It's such a wonderful way of working with people.
Yeah, yeah. The ability to lean on different aspects of the music is so powerful. I'm thinking specifically of like the importance of rhythm and just, you know, having the brain having like almost like a metered thing that tells it how much time there is between one beat and the next beat can help with so many different things. And I mean, time awareness is one thing, gate training is another. Both the melody fading and the gate training are both techniques from neurologic music therapy and that whole school of thought. But I think with, you know, most music therapists over time, just sort of our training is always adding different aspects of how we work and different approaches to music therapy, because there's so many different ways to use the music.
Yeah. So, you know, with dementia, there's all different kind of changes with experience, right? And sensation. When you see someone that you're working with, do you have to do like a baseline test to kind of see like what kinds of sounds they respond to, or if they're having any kind of like agitation to like a certain type of, you know, like sound or aspect of music? Because I often hear from people living with dementia that, you know, like the way that they're getting information is changing and they're not used to it. And so they really have to like choose their environments to be pleasant in a way that they are adjusting to. So I was just wondering kind of how do you deal with that with music therapy? And can you kind of take advantage of that to like put more of the thing that they like or less of it?
That's a great question. I'm immediately thinking of what comes up in our groups when we've done quite a lot of improvisation, and how an environment can affect someone having these different sensory experiences or taking in elements of processing both language and music. And now this person's putting a drum in front of me, like what's happening? At least for me, it's been, you're constantly reassessing what's happening in the room, tailoring that experience to that person at that moment, trying to remain in the here and now, bringing the music to wherever somebody's at. So the music can fluctuate and meet what's happening in the room. We can sort of name what's happening in the room through music. We can bring it down, we can bring it back up, or recontextualize some of those experiences that might, on one hand, be a little difficult for someone. I'm thinking of many of the veterans, they have tinnitus. So there are some frequencies that can really affect their experience. So there's aspects of what are the tones that I'm using? What are the actual, is there low tones? We have low tones of the drums that won't kind of interfere with those frequencies. Do we not use the tone chimes, or we recontextualize aspects of that, in the group music making process and bringing it back to like the here and now, letting them know that they're heard and, the music is there to meet them.
Mm-hmm. Yeah. How do you accommodate hearing impairment, which is, pretty common for older adults?
Mm-hmm. Yeah, that's an interesting. You saying that reminded me of the role of hearing aids too in all of this, because hearing loss is definitely a huge factor. It's a little bit different for everybody, just because there's some general things, right, where most people will lose the high end is the most affected, and so different. Especially sounds more on the treble end of the spectrum can sound different or be missing from the processing. Sometimes, depending on how that particular person's dementia is progressing through their brain, it also and what areas are affected. If the hearing centers are affected, sometimes that can that can affect the perception of the sound, almost independent from the actual functioning of the ears as well. Because sound is, there's the physical processing of it too, but then there's a whole other process of your brain interpreting, similar to like with your eyes, right? Have you ever done one of those experiments where like you have the glasses and then it flips you know what I mean? And then over time, your brain reflips the image, even though technically it's still coming into your brain the wrong way. And I think, there's somewhat similar processes sometimes with us making sense of the sounds that we hear. And especially because our ears are something that, unlike our eyes, we can't close. So on one hand, we can use that to our advantage when we're working with folks who are further along the process and deeper into their process, where sometimes those receptive methods are really, really important as additional skills become harder to access.
Yeah, it really reminds you that the brain is like filling in the gaps for so many different things. Yep. I was a graduate student at Carnegie Mellon University, and there was a big cognitive psychology department. And one of my friends had me do some experiments where it's like they say like ba and da, but you're looking at the screen and it's saying like it has like the different one, and you start to not be able to know like what you're hearing anymore just based on like the visual stimulus. So maybe that's kind of like a window, right, to like tell you how like the brain might be changing, with any type of like pathology or different change in your life to fill in different things in different ways, right? And the more that we can kind of experience that, I think, and have empathy for those changes, I think is really helpful too. So thanks for highlighting, like the difference in between like what are the things that are happening and how we fill in that information too with our own experiences. I think one of the things that we've kind of talked about before, Daniel and Shannon, is the idea of having continued relationships with someone, kind of in the early stages of dementia, maybe into like the late stages of dementia or to the end of life. And I know you're at the VA, so you get to see people, in different situations, and you might know them from the beginning to the end. Like, how does that shape being a music therapist?
Yeah, that's a great question. And it's a really, really unique aspect of my own experiences working with veterans at the VA, because again, yes, I'm sort of partnering with a lot of different clinics throughout the entire VA system. So as we've had our group, I've been in outpatient mental health clinics. I work on the inpatient sides of things in their medical rehab and hospice unit. So there have been many opportunities to follow veterans as they transition from program to program up until end of life. So it's just this really unique aspect of it where you become acutely aware of how we can meet goals in our work together. There might be individual goals, but there are these inevitable community goals that happen where part of those goals might be to navigate to that transition to the next program and get support either through the system or through other veterans. I'm reminded of one veteran in particular where we didn't necessarily meet in our dementia group, but a person who got referred to an outpatient mental health clinic that I was working in was a very, very active member of our community music group. And this person transitioned into hospice care. And we sort of navigated that process together. And one of this person's last wishes was to play with this community band. So we brought the band to the hospice unit. It became a big sort of performance opportunity for other veterans in that group. This person was able to sort of get that experience of playing with their group members. The group members got a chance to have closure and say goodbye to this person. Other folks, staff members, we talked earlier about how music can sort of unify and also affect caregivers on a hospital unit. So like we had nurses, other folks sort of just join in and be like, I'm grabbing a drum or I'm grabbing a shaker and people are dancing. So it just changes the environment. The ability to just see a person change over so many different ways is humbling, and very grateful to be able to be a part of that, to accompany that. I found that the aspect of community just in my work across the board has just become more and more apparent the longer I dig into this practice at the VA.
Mm-hmm.
Yeah.
Yeah, and Shannon, you work at the Resilient Living Center, right, at LiveWell. Can you say a little bit about that and how it kind of relatedly, can connect to different experiences of a person living with cognitive change over the time?
Yeah, absolutely. LiveWell is kind of at an interesting place as an organization because we just underwent this huge expansion on our campus. And so we had previously a 120-bed skilled nursing spaces, and then a small 13-bed assisted living space. And we've now added 2 entire houses of assisted living, and now we're offering community programs as well, and reaching a little bit more into the earlier stages. I think that people earlier in the process tend to be a little bit resistant to reaching out for help. They don't want to reach out until it's like 100% can't, no choice about it. But, similar to the dynamic in hospice care, oftentimes it's like, oh man, these services are available. And if people were able to access them sooner, or felt okay about accessing them sooner, that so much more function can be preserved. But in any case, so now I think it'll be interesting because even before, when it was mostly just a small assisted living and the skilled nursing neighborhoods, it was still that process of starting, meeting somebody in one place and then over time sort of witnessing the change and walking with them through that change. And as you know them as a person too, you get to know how they communicate and how they, what makes them happy, what is, just different things about their life that help them feel seen and respected as a whole human. And I think part of our challenge as a culture is how we honor and respect those who are in the later stages of their life, which, as a country, I think we have a long way to go. But so I anticipate that as we expand now into the earlier stages, that will be even more amplified, where we're going to be meeting people even earlier in the journey. And now that we can offer the entire continuum of care, where people only have to move once, and then that one place will have everything they need. They don't have to make several moves after that. I think that will expand over time.
Mm-hmm. Yeah, I mean, one thing I really like about the Resilient Living Center is that everyone from the community is invited to be part of it, right? So you don't have to have cognitive change to go and do music classes or art or all of these different things. And I think that's kind of the way to go, right? For anything is like it's accessible for the people who would need that accessibility, but it's welcoming and fun for everyone. And Daniel, I know you work with kids and things like that, but are there kind of any plans for anybody for more intergenerational programming with music and people living with cognitive change? I think that would be really cool to do.
That would be really cool to do. Yeah, I think any opportunity you can take to provide sort of a connection between generations is always beneficial. I think it just speaks to the inherent benefits of building community like the one that's like the community that's happening at LiveWell, especially how it's open to the community. That's incredible. I could see bringing in, music groups with early childhood and older adults for sure. We had, this is a little bit of an anecdote now, just one of my music groups, our coworker brought in their child to work and just brought in their child to one of our music groups, and it just lit up the room,
Makes a huge difference.
Yeah, huge difference. And they're, these are veterans of average age of, mid 60s, everybody just was like laser focused on supporting this child, and they became more playful in what they were doing. We were talking earlier about how to find instruments about that are age appropriate, and all of a sudden they're like, singing Itsy Bitsy Spider, but like holding like a really nice like pair of bongos. The more community, the better.
Yeah, absolutely. Yeah, we've been certainly focusing on that a lot and expanding intergenerational programming at LiveWell. I am super, super excited over the summer. One of the ways that we're reaching into the more intergenerational spaces, our summer concert series. I'm so excited. We got funding to do 2 concerts a month from June through September, 2nd and 4th Thursdays. And so we're bringing in, we have a Beatles tribute band on Thursday starting. So we're kicking it off this week. But all through the summer, we've got bands that are just like a big band and a yacht rock band and a country, not country, like Irish Celtic folk group and Billy Joel tribute, and it'll be so much fun. And they're designed for families to bring their kids and for it to be like, so it's free and open to the public. And so there'll be sort of sunset concerts. We're encouraging everybody to, bring dinner, bring some drinks and just sort of like relax. And, as much of a champion as I am for music therapy in particular, I think, there's such a need for community music as we've been saying, right? And like you were saying before, Daniel, like we don't own music, obviously, but so I think those experiences that bring everybody together with music is so ancient for us as humans, right? Yes. That like using music to help our communities kind of become more glued and more connected, and to share experiences together is such a beautiful thing and such a wonderful way to use music.
Absolutely. And again, like as clinicians, like our own approaches and techniques, or how we view how one functions in music, that can still work hand in hand with offering something like that. It just sounds like a wonderful space. I had to say, I chuckled before, not at like the whole idea of it. When you said yacht rock, I'm like, glad yacht rock is that's an official genre.
It is an official genre now, yes.
That's definitely the music from my childhood that I listened to like with my mom in the car. So it's like I know all the words to all the songs.
Oh yeah. Same. I heard a lot of that stuff growing up. Summer Breeze.
Yeah.
Yep, totally.
Yeah. And I think, music, the way you were talking about intergenerational experiences, is it allows people a way to play. And I think there's like this barrier for adults to feel like they're not allowed to. But if a child is in the room, then they're allowed to, and then they get the benefits of that. I find that with like some of my like visual arts experiences that I do, that it's like if you're doing art and there's like kids there, then the parents or like the older adults will like engage more because they're like supporting the kids. But otherwise they'll be like, oh, I'm not an artist, and they like won't even try. And I think a lot of the time, like, the people are the happiest are the ones that are just like, I don't care. I'm just going to try different things and play and look, stupid or whatever. And it's just about the experience. But I think we're just like not set up for failure a lot, like to expose ourselves as not being good at things. And maybe that idea of having more kids around with like maracas at a music thing like would allow more people to like pick up those maracas and sing those songs, because we also want to be like careful about infantilizing people, right? Because adults are not, children, and we shouldn't, even though like some of the same techniques can work, it's like you want that dignity too. And I think, but sometimes, that barrier too can not allow for play, right? I see that in a lot of situations where it's like, some like long-term care people will be like, I can't believe they had the parachute thing out because that's infantilizing. But then another place will be like, oh, but they like that here or something like that. So it's an interesting kind of dilemma, right? Like when you think about what songs people know, a lot of them are from childhood, right?
That's a good
like,
point.
and they're very ingrained in us. So we can just pick that up at any moment.
Absolutely. I think it's that's an interesting point. It brings up a recent experience I had with one of my groups. So one of the groups I run, it's twice a month, and it is a veteran and caregiver support group. So these are caregivers and their spouses or loved ones with Alzheimer's and dementia. They come in with a support group. They work with a social worker. I work with the veterans right next door. We share a wall in music therapy. And recently we had our first group where we brought everybody together. So basically, I think essentially all the caregivers like, we just want to hear like what's going on. Like we hear you guys drumming all the time. Like what's happening? So had everybody in the room. And one of the songs that folks instantly, and this came out of a discussion of familiar songs and what we might like to sing. You Are My Sunshine, right off the bat. And a room full of adults, older adults, earnestly singing this song. And some of them talking about there was like a other aspect of talking about the meaning of the lyrics and how it's like, you think of it as a children's song, but it's like this really sad country song. So there's like a recontextualization there. But even just as the therapist thinking, wow, like we are singing You Are My Sunshine, and this, it's not infantilizing in that moment. But there's that interesting dichotomy of play versus, am I too old to play? Or like that's a constant point of discussion in a lot of the groups, allowing someone that moment to engage in a playful way.
It's funny that you bring up that song, too, because that's the song that I used to sing into the microphone in the basement while my dad would play the electric guitar next to me.
Oh, yeah.
And so I used to always be like, can we go play like down in the basement? Guitar and You Are My Sunshine. Oh. So, I have like that vivid memory like in my mind like that. And it's like, ooh, goosebumps.
Wow.
Thanks for bringing that up, too.
Yeah, what a lovely experience.
Yeah, I know. Right? My dad's really cool. But I think I kind of wanted to get back, Jody, to like a little bit about this research aspect of it too, because, I study things like love and emotions and things that are very much like I could feel the same feelings as you were when you were like, music has so many different aspects to it. How would you do like a tightly controlled study of, music? And it's like, I'm in social behavioral sciences. It's the hardest type of science to do because social and interpersonal and behavioral influences are so complicated. We can't just put them in like a petri dish and do an experiment. But there is still value in raising up like this type of area for research because then we kind of know like what would be the most potent public health intervention to do, right? So maybe, Jody, you can kind of speak to this aspect of like what is the role like of music therapy or music approaches to dementia in how we care for people living with dementia and their families in a public health type of way in our country and all over the world. I know it's a big question. You have a lot to answer, but I just want to highlight like how important this research is because, science most of the time is thought of as the way to, show that something is like worth to invest in, right, for our country or make decisions about public policy.
Totally. Yeah. So I have so many ideas. So I'll try to organize it. I mean, in terms of public health, what that reminded me of is, a loneliness epidemic was declared by the Surgeon General a couple of years ago, and kind of starting small in my own primary care clinic at the VA Center of Education. I definitely saw that kind of on in the veterans that I care cared for. And that was partly one of the impetuses for reaching out to the music therapist there, Daniel, and Bobby Blake, who is now retired. But because primary care is essentially the entry point for everyone to healthcare, dementia is actually very underdiagnosed, although loneliness is even worse in people with mild cognitive impairment or dementia. And so at that time, there were some wonderful like dementia and caregiver music therapy groups and inpatient many opportunities, but it wasn't like specifically in primary care. So we made a quality improvement sort of pilot project to educate the primary care clinicians on music therapy, and then sort of elicit referrals from them for patients with a focus on MCI and dementia, but really no formal diagnosis was required. And then we looked at sort of loneliness before and after the 8-week session with Daniel, as well as did some interviews. And we did find that participating in the music therapy group significantly decreased veterans' loneliness. We used a 6-item de Jong-Gierveld loneliness scale. Particularly their emotional loneliness was greatly reduced. And then they also had some like qualitative themes. So from talking with them, camaraderie was like the biggest thing that kept coming up with all of the veterans. They also talked about like accessing a range of memories and emotions, and then reimagining of their identity. Some of our members were musicians, but they like found new ways to access music and different instruments and experiences. And then some kind of started out thinking, not knowing what to expect, but then realized that their contributions to the group were so valuable musically. Yeah, I don't know if Daniel wanted to add anything. It was really special.
Oh gosh, it was incredibly special. That's a great way of the tail end of that, talking about the coming into it, what they were bringing to the group in terms of the loneliness they were feeling with whatever their respective journey was at the time, in addition to the level of prior experience they had with music. Because we had a professional drummer in there. We had folks who had never touched an instrument before. We had like a poet, but not necessarily would think of themselves as a musician. So there were so many opportunities where folks came together in different ways each week to relate to one another in a very specific way. And I think to your point about the loneliness epidemic in the veteran community, that's kind of magnified. There often can be an inherent feeling of isolation or loneliness for having gone through the experience of serving in the military and what might come up for somebody during that time. So in that aspect, it just feels a little bit more magnified. Again, I know the word camaraderie is huge. So for someone to relate to other veterans and feel like they can engage with other folks after having a lifetime of experiences is really powerful. We had... I keep bringing up this example. We had this great example of like, we did an improvisation and the poet in our group came out with I brought in a poem today. I don't know if anybody wants to hear it, but can I read it? We read it, we listened to it, and folks were really affected by it. We determined as a group, how could we musicalize the way it sounded? And our professional drummer at the time was like, okay, it's going to sound like this. It's got like a kick drum that kind of sounds like a funeral march. And we were off and running, and you could just feel like an uplift in the room as this person began to read their poem. Kick drum comes in. Someone comes in on like we have what's called I call it a happy drum, like a melodic tongue drum, hitting these tones. It kind of sounds like a steel drum almost. To witness that was very, very, very powerful. So just to reflect kind of what you might read on the page of the results of the study and what actually happens in their room to get them to give the score that they did.
Yeah. The storytelling aspect of research is so important because, like, as you were saying that, like, I was feeling it. I was there with you on that, So I think it's so important for us as researchers and scientists to just remember that we kind of need to pair this information with the actual story so that communities kind of understand like what the impact is of this. Because, the scientific journals need one thing, right, to show results. And then the community needs a kind of another thing to give more, like passion and effort and awareness and support to make these things actually happen. The last thing I wanted to ask you all is kind of what is your favorite thing about being a music therapist and kind of what keeps you going in this career?
Where to start?
I felt myself want to exhale too, because you review all the experiences you've had thus far.
I mean, we have the best job in the world. I mean, we do. We're very lucky. Music is just it's magic, and it's science, and it's emotion, and it's all the things, and it's such a good companion for us in so many different ways. And it's, again, like we were talking about before, just so modifiable to whatever it is that people are needing. And that modification aspect is so important. As we think about elder care in the coming years, the ability for us to tailor things to specifically what people need is going to be super, super important. And one of the things I wanted to mention earlier is that some of the recent research in brain health and dementia shows that up to, I think, like 40% of the risk factors are modifiable. And so we tend to see dementia as something that like you get or you don't get. But there's so much that we can do to take care of our brain health. And I think as a research community, we discover more and more that highlights the importance of that, of what are we doing. It just circles back around to like, you don't have to wait until you get a dementia diagnosis to start caring about your brain health. And also I'm a huge champion of just music is one of, I think, the most time and cost effective ways to take care of your brain, and enjoyable too. Right. There's a lot of the work that we do and LiveWell is built around the finger study with the modifiable risk factors identified in there. So our programming is built around this idea of trying to support all of those things as best we can. But yeah, so I'm excited about just being here and being in this space and everything that as a collective we're discovering is I think, there's just a huge wave of momentum, I think, in this space that's going some really interesting places. So excited to see where it goes.
Yeah. Second, everything you've said about music. I agree. We do have the greatest job, and to be able to, walk into work every day carrying my guitar or, unlocking a cabinet full of these like instruments. I feel like I'm opening a treasure chest every time. And there are these moments where you just get to see people, do these amazing things. It's kind of personal for me because I think what led me to music therapy in general was I did do a lot of work with kids. I was like a freelance musician with early childhood. And I just found that, I came from the world of musical theater as well, so I just loved singing and acting and, performing. But what was really central to me in a lot of the groups that I ran was just being kind of this like facilitator facilitator of bringing the music into the space and just like handing it off to other people and seeing what they do with it, and how can I keep that going rather than like, everyone listen to me, and there was just this aspect of Connection, yeah. So that those moments of connection that happen over and over again when you're interacting with someone in music.
Yeah.
It's like, it it nourishes you in a way that's very unique.
And the nonverbal connection piece of it too is so important.
Yeah.
Yeah. That it can be verbal and lyrical, but
absolutely,
in essence, nonverbal in many ways.
Yes.
Yeah, being a teacher in many ways is so gratifying. You're like giving people like the basic tools, and then you see what they do with it. And I imagine in music, it's like an incredible experience too. Yeah. And Jody, how about you? What keeps you like focused on this area as part of being a doctor?
Yeah, absolutely. So I was a piano performance major before pursuing medical school. I sort of got into like geriatrics from an experience kind of late in medical school, playing piano for a couple with dementia in their home. And it was just so eye-opening. I had never performed it or played in such an intimate setting before, where we would like talk between songs, like laugh, cry, like they would dance. It was just so, just a very strong relationship. And later I kind of learned from their daytime caregivers that what the information I was getting from them was very unusual. Like they didn't usually talk like that or remember their day. So it was very, very powerful. And I think going off of, I know we talked a little bit about the research. It's just such a exciting field. I mean, now there are studies using like functional MRI and other types of structural imaging that actually show it like improved cognitive function and increase in myelination, like improved structures in the brain after music interventions. In medical school, like we learn about dementia being sort of a progressive decline. There's no like recovery. But I think that experience that I had, and also looking at research, it's like there can be some like new pathways that form that allow you to speak through like first singing and then kind of building these other connections. So it almost goes against, the grain of some of the really difficult things that we learn about dementia that I think maybe push people away from that field. I think music like draws me towards that. There was one study, like a trial that showed people in kind of early stages of dementia really regained and improved like their verbal fluency and memory. And so that's just one example. But yeah, that keeps me kind of going and really, really hopeful for this field and for more opportunities for music therapists to really integrate into kind of the mainstream treatments for dementia and actually many other diseases as well.
Yeah. Thanks for leaving us on that kind of sentiment of hope, and that, if you have cognitive change or impairment, that, it is a journey and it's not necessarily like just going downhill. Like there are changes throughout, and there are things that we can do, and music is probably one of the best options to do that. So I just wanted to thank you so much, and I know this is not going to be my first time hanging out with all of you, or my last time hanging out with you. I mean, I did on Zoom already, but it is the first time in real life, but it's not going to be the last time. I can tell you that much. Because, I feel like I want to get reconnected with music again, too. Because, again, it's never too late to start thinking about taking care of your brain in so many different ways. And, music is definitely one of them. So thank you so much.
Thank you for having us.
Thank you very much.
It's a wonderful conversation.